So the Omicron variant has had the world on alert, and at least 21 cases of the Omicron strain have been detected in India so far. Now I have Mihir and Revati joining us. Mihir from Mumbai and Revati from Bengaluru to give a sense of if there's panic on the ground, if at all, and how are people reacting to it? Because governments can do so much, authorities can do so much. At the end of the day, it is people like you and I who will have to take care of ourselves and our families. Mihir, let me come to you first. As far as Mumbai is concerned, are people scared? Do people realize that there is a new strain which is classified or labeled by the World Health Organization as a variant of concern? This is for the second time after Delta by the WHO was labeled as a variant of concern. Is there some sort of responsibility that we're seeing in Mumbai towards at this point in time?
Well, as far as people at large in Mumbai, no, it's not seeped in at this point, but the authorities are taking no chances. What we know at this point is that the authorities have uh, applied certain curbs. However, the state health minister has said that there will be no curbs at this point. There's no need to panic. But in terms of curbs, what we are seeing is that, the local transport will not be accessible to people who are not vaccinated. That is one rule which has come out. Apart from that, schools which were supposed to start for children from 5th of December have been postponed till 15th, and these are children from 1st to 7th standard. So that there has been some amount of concern from the authorities. Also, all the war zones as far as COVID are concerned have been activated in Mumbai. Mumbai is on the edge because there is one particular person who has been tested positive of COVID-19. However, his genome sequencing report is awaited, and there are chances that he could have contracted the Omicron virus. That is a cause of concern. But on the ground, what we are seeing are brazen excuses by people at this point. Also, we know markets have opened up. People do tend to crowd the markets, but the sense of responsibility and the need to maintain COVID protocols are not seen. In fact, today I was at the Dadar market, and many of them, many times earlier, were not wearing the mask properly. Social distancing was out of the window. The larger concern is with travelers, especially travelers in Mumbai. Also, there are several people who have been waiting, to step out of the country on the pretext of spending some time with family or on business trips. All their plans, in a sense, have come to a standstill with this new variant, and largely it's the concern around the variant and the kind of back and forth we are seeing with the guidelines is what is making people more.
Okay. Okay. So Mihir, they're pointing out that people are still lax despite
Authorities
different.
said no need to panic, but one needs to keep a strict vision, and people also have to show some sort of responsibility in order to, tide this another wave if it comes at all, hopefully in a proper way.
All right, Mihir. Revati, I'm going to come to you next because I want to ask you whether in Bengaluru you're seeing the same sort of COVID appropriate behavior both and in Maharashtra. Omicron positive cases have been found. There are more suspected cases, more samples for genome sequencing have gone. But Revati, on the ground, are people being responsible?
Well, it's not up to the mark. I'm standing slightly away from the crowd right now because of the noise issues. But a while ago, I was at KR Market, which is crowded at any given point of time. And only when there are BBMP marshals enforcing COVID norms, or when there are cameras out there, media cameras out there, that people actually remember to mask up. And as soon as the cameras are out of the place, or when the BBMP marshals move slightly to a different area, immediately the masks are down either on the cheek or the neck, or no mask at all. So that is the behavior that we're seeing on the ground. And with the Omicron variant, the case that was detected in Bengaluru of the doctor who had no travel history really points to the fact that the variant is already existing here because we don't know the source of infection for that particular case. So there are stringent measures that the government has put out at this point in time. We also have concerns with regards to educational institutions where there are cluster outbreaks. So all the events that are planned in educational institutions must be postponed to after 15 January 2022. In public places, if you have to enter malls, theaters, shopping complexes, you will have to be completely vaccinated. Only if you have taken 2 doses of vaccine can you enter these places. The staff of these places must also be fully vaccinated. Government staff must also be fully vaccinated. So all these measures are in place. But on the ground, of course, the fatigue has set in. It's been 2 years into the pandemic, so people aren't really that serious as far as COVID norms are concerned. They are having to be reminded time and again. Every few minutes, BBMP marshals are out there making announcements, asking them to mask up. Just a while ago, when I was at Care Market, which is just a few hundred meters from here. So yes, reminders have to be put out from officials for public to adhere to COVID appropriate behavior, but otherwise on the ground, not much of seriousness in terms of the guidelines being followed.
Now, both to you and Revati and Mihir, I'd like to ask you both have been covering the outbreak of the pandemic from the beginning of 2020, it's almost 20 years now. The measures that have been taken by both states, do you think it's sufficient? Do you think it suffice? Or do you think more stringent and tighter measures should be taken by both states, Karnataka as well as Maharashtra? Also, because Omicron variant found in both states. Do you think that what the governments are doing at this point is enough or more needs to be done? Revati, if you can answer that first.
Well, there's a consistent effort in terms of testing, tracing, tracking, as well as in terms of vaccination, which the government is giving utmost importance to. But of course, the seriousness of that enforcement on the ground really is seen when there is a sudden reaction or when there's a sudden variant or a new variant that comes up, when there is a situation that arises or when there's a cluster outbreak, then you see that the seriousness is even more on the ground. But otherwise, of course, there are times when everybody lets their guard down in terms of the government or from the side of the public. That has been the case in the last 2 years. Only when there's a new variant that comes up, that is a concern. Do we see that the level of seriousness increasing on the ground? But otherwise, yes, there is a consistent effort in terms of vaccinating people. In fact, Bangalore Urban did become the first one to quickly vaccinate 100% of its population with the first dose. With nearing, the entire city getting vaccinated 100% with the second dose as well. So there is effort taken in terms of vaccinating the maximum number of population. That is the focus that the government is putting on. And now with the new variant, there's again stringent measures on the ground. You're seeing BBMP marshal out there, BBMP officials out there enforcing guidelines. And at the district level, various districts also, the officials enforcing these guidelines. And then at the international airport, all of them getting very serious because of the concerns around the new variant. But we'll have to see whether that will sustain for a longer period of time until we can be sure that we are safe from the pandemic.
Okay, Mihir, if you can answer that question now, in Maharashtra, do you see that authorities are doing enough, considering it's not 2020 now? We can't shut down the economy, but what can be done is perhaps, say, imposing heftier challans for people who are, say, not wearing their masks and so forth. Is it happening on the ground?
Uh, Unfortunately, not. That's not happening. The reason behind that is also because there are several industries that have started, and it is important to give them some sort of space for its proper revival. The travel industry is already taking a beating with the threat around Omicron virus, but on the ground there are several industries. Yes, we know that there is a fear of another wave if this Omicron variant tends to seep into the maximum city and infect a large part of the population. But the emphasis right now is on making sure that people can go around and do their daily jobs, daily work with the kind of protocols that are basic put in place. Apart from that, what the administration at this point is doing is that they are trying to ramp up the infrastructure, make sure that the foreign travelers are isolated, kept in separate areas, make sure that proper testing is done. Those with suspected infections are taken through that lengthy process of tracing and then identifying one with high risk and low risk contacts. So these are some of the measures taken. Apart from some short, small curbs that I mentioned earlier, there are no real restrictions to restrict movement of people and restrict the business at large. But it all remains to be seen because Mumbai is on an edge in every matter of speaking at this point. If there is a confirmation on that person from Dharavi whose samples have been sent for genome sequencing, but then tables could turn and there could be stricter measures and curbs that could come in place. At this point, the BMC is clearly stating that one need not panic, but yes, ensure and maintain the COVID protocols that are put in place so that in case of an eventuality, in case of the infection really spreading like wildfire, they get some space and time
Okay. Okay,
to
Mihi.
also vaccination is going to play a vital role. In fact, the BMC has reached out to the center asking them to reduce the time between two vaccine doses. Remember, Mumbai has 40% of its
Yes.
population completely partially vaccinated, and 100% have already taken one dose. So that needs to be speeded up, and that is one of the main targets of the BMC at this point.
Okay. Now, as far as the Omicron variant is concerned, early studies are indicating that it has shown mild infections in people. Now, of all the people who've been tested Omicron positive in Maharashtra and in Karnataka, can Mihir, you and Revati throw some light on as to if all these cases who are Omicron positive in your state mild are they showing mild infection, because that'll be really important to watch. Are most of these people who have found to be Omicron positive, are they doubly vaccinated? Revati, can I begin with you first?
Yes, Karnataka has had two cases reported, confirmed cases of Omicron variant. The first case was of a South African national. Now, in that particular case, he had tested positive when he arrived. He was isolated at a private hotel. But when his sample was sent for genome sequencing, during that period, he got a negative test report from a private lab, and he left to Dubai the next night. Around midnight, he took a cab and left from the hotel. So sort of like he without informing the officials, he left the place, so which is quite an irresponsible thing to do for anybody who is testing for COVID-19 positive. But of course, because of the secrecy around it or the privacy concerns in the airport, officials, of course, may not have known that this person's sample had been sent for genome sequencing. The second case was of the doctor from Bengaluru, a local who tested positive for COVID-19 of the Omicron variant. He does not have a travel history. Now, that was been a bigger concern because we don't know the source of the infection. And this also points to the fact that the variant already exists here. Now, in terms of symptoms, he has had only very mild symptoms as per reports, and temperature or the milder symptoms, and he had already discharged. He was already discharged from the hospital or from his quarantine. But once the genome sequencing report came that it was an Omicron variant, he was sent back to Bowring Hospital where he is quarantined. Now, five contacts of his had tested positive, including primary and secondary contacts. Those samples have been sent for genome sequencing, and we're awaiting results on that. So in these two cases, the first one, of course, we do not know much about the symptoms because we have not been able to get details of that person. He fled from the spot is what we're given to understand. The second case, we understand that the symptoms are very, very mild and not, much of a concern or worry for that matter. And the others who have tested positive, his contacts too, are doing absolutely fine. So that is not a cause of worry at this point of time as far as those who have tested positive for the Omicron variants are concerned in Karnataka.
That is some good news. That is some respite from Karnataka. Mihir, if you could throw some light as to what the situation of the Omicron positive patients in Maharashtra is concerned. Yesterday evening alone, 7 new cases of the Omicron variant were reported, including children. Just a quick status on how they are. Are they in hospital right now? Mild symptoms?
Absolutely. In totality, there are 8 cases from Maharashtra. Now, remember, the first one came from Dombivli Kalyan, which is Mumbai metropolitan region, quite close to the maximum city. I'm sorry. This was basically had a travel history. Of course, he was coming from South Africa via Delhi. He came to Mumbai. And now, what's important, and that's what also the state health minister Rajesh Tope stated, that he was not vaccinated, and then putting the stress and emphasis on the need to get vaccinated in order to just protect yourself from this particular COVID-19. Apart from that, the remaining 7 have come from one from Pune and others from another
We seem to be losing the connection with Mihir, but essentially what he is also trying to tell us that as far as Maharashtra is concerned, there is a need to get vaccinated because some of the people who've tested positive for the Omicron variant are not vaccinated or are partially vaccinated. Also, mild symptoms being reported even from Maharashtra. So that is again a good news. Another good news is that as far as the Omicron variant is concerned, it can be detected in RT-PCR tests, and which is why the need to test, not just most people who are coming in from the airports, passengers, in fact, who are coming from at-risk countries, but also testing. Overall testing needs to be increased. That should where the focus be on contact tracing. That's what the health ministry is again and again focusing on. Contact tracing must be done of all the suspected cases that are coming in. Primary, secondary contacts of all these people need to be done. Now, as we talk, Omicron cases are multiplying in the world, perhaps in India too. In the coming week or so, this number 21 Omicron cases right now, but this number could get bigger because more results of genome sequencing are expected. But what you and I can do is, of course, mask up, avoid gatherings, and get vaccinated. Thanks so much for watching. Bye bye.